morning to you. You're with me, Miriam Angel, Salim Barisa, and Emmanuel Gona. It is 25 minutes past 8, and today being a Thursday, of course, we look at everything that revolves around health, our health. And in studio, we have a nutritionist, and we have LilySophie Marao, and she's a clinical nutritionist at Ganjoni Hospital, Mombasa. Lily, good morning.
Good morning. How are you?
I'm good. How are you?
I'm good.
Good to have you here.
Thank you.
Now, March is National Nutrition Month.
Yeah,
correct. And so it's meant to promote the healthy eating and physical activity. And it's also time to recognize the importance of making informed food choices.
Yeah.
Right?
Yeah.
But we hardly do that because tunasemanga, I really want this, so I eat it. And you know, I eat when I'm not even supposed to eat. Sometimes I'm shiba, but I still want to add more food, you know. So, Lily, guide us through World Nutrition Month. What is good nutrition and why is it important?
Okay. Thank you very much for this platform. As you have heard, my name is Lily. I'm from Ganjoni Hospital.
Yeah.
Mombasa, the private one. So, nutrition is wide. And nutrition is very broad. So what I would like to tell the Kenyans, or in particular my fellows from Mombasa, you are what you eat. Whatever you eat right now will determine how many years you're going to live and how you're going to finish your old age. So most of the young generation, especially the Gen Z and the millennials, most of them tend to have some eating disorders. Which either make them to eat more or eat less. So most of them are of the notion of quantity for time. They don't have time to go and cook food in the house, so they rush for the fast foods.
Yes.
Which those fast foods don't have enough nutritive value. And nowadays we say diversified diet. There's nothing like a balanced diet. So a diversified diet is good nutrition, where you're going to incorporate everything on your plate. So when we do that, we're going to prevent the lifestyle conditions that will come into place if we have a bad nutrition in our previous life. You've talked about eating disorder
and where somebody eats more or they eat less.
Correct.
For some people, they would say, okay, fine, I want to eat less, and that's okay, but you think that's a disorder. Could you break that down?
There's most of the Gen Z and the millennials are watching their weight. One, because of the influence of the social media. They want to be thin, have a thin waist. Most of them also go for these fat diet programs for them to have a rapid weight loss in a very small period, which in the long term leads to some things we call ketones, which later on leads them to diabetes in the later future. Some of them want to binge eat. They eat a lot because of they are stressed, they are depressed, they have less sleep. So they end up eating. They're eating under stress, which again leads them to obesity. Obesity right now is on the high lead with the millennials and the Gen Z. And that is why in the later years and in my years of practice, I have been enrolling young people and elderly people as well with diabetes.
This is now because of stress, because you're stress eating.
You're stress eating. Now you're eating a lot. You are giving your body unnecessary hard work to try and convert the energy so that the body can use it. So if you eat a lot in excess, then a lot of blood sugars will be running inside the body, which means the excess sugars will be converted and stored as fat, which means you're going to gain weight. Yes.
Tukiwa hapa kwa overeating na kueat kidogo, kuna standard ambayo pengine maana zamani nikikua ilikuwa tunajua asubuhi, mchana, jioni. Mimi jioni ndo siku hizi napenda kula. Hizi stories za asubuhi, mchana si mambo yangu. Sasa kuna issue kwamba inafaa kukua pengine asubuhi ama masaa gani ndio sasa tuanze kurekebisha, maana nimeona tayari niko taaba.
Uko na disorder.
Niko nayo.
Okay, when it comes to feeding, most of us are used to maybe 1 meal a day or 3 meals a day. But put in mind that any slight mistake or if you joke with your body, it will cost you in future. So in regards to how many meals I'm supposed to take in a day, it will depend with the physiological state of the person at the time. Of course, a pregnant mother will not take 3 meals like you.
Yeah.
A lactating mother will not take 3 meals like you. But someone who is working in a sedentary lifestyle, like the people in the media, you cannot eat 6 meals. I'm going to limit your meals to either 4 or 3 meals.
Okay.
Yes, because when you eat 6 meals and your work is sedentary, you don't have a lot of movements, which means your body will not be able to consume all the energy, which means it will be stored as fats. But there are specific calories for different age groups, for different genders, for the males and females. So that's why you need a clinical nutritionist to come and do an assessment, and then he or she will be in a position to tell you how many meals you're going to take and what you're supposed to include and what we can omit.
Okay.
Yes.
With what Gona has asked, he says he does a meal a day. And I'm assuming pale usiku anakula ni kama you know, he's recovering. You know,
to be specific,
the fact that he didn't have breakfast and he didn't have lunch. So he's putting all these meals together. Usiku. Is that unhealthy?
Yeah. One question I'd like to ask Gona: Do you love your life?
Yes, I do.
So whatever you're eating, you see, the whole day you have deprived your body from food. Okay.
Yeah.
And then the only time you get to eat food is in the evening. That's why you have to eat a lot of food for you to psychologically understand that I am now full. And my understanding is that you're coming from work late, and then you'll have to eat, and then because you're tired, you'll just immediately go to bed. So what time have you given your body for it to metabolize?
To burn the food.
To balance the
Nikiwa
food.
kitandani haiwezi.
No, it's supposed to give yourself at least 3 hours after meal for it to digest. In fact, kama kula vitu kama protein haidigest immediately, it will take time.
Saa 6 usiku.
And then again,
yes.
When you've deprived yourself of food, the sugars tend to go low. Okay? So when you eat immediately, the sugars will spike, which means now you start feeling sleepy, dizzy, lazy. The sugars have already spiked. So the fluctuation of on and off of the sugars will lead the fluctuation of on and off of the sugars. That's when now we are starting to bring up diabetes in the later future.
We'll go to diabetes.
So mimi niko na swali hapa. Jana a very prominent figure online aliweka picha ya zamani na ya sasa. Alafu akaandika avoid eating food past 7. And kama ni kula ule kabla ya saa 1. Alafu pia akasema make sure unaondoa carbs na sugars. Is that healthy?
Okay. Yeah. I have understood your question.
Yes.
So why we say we should eat not past 7, why? Because most of the people eat and immediately go to sleep, which we don't want. We are eliminating carbs at night and sugars because we are avoiding to overwork our body during the night. And number 2, we are avoiding to have stored fats under our skin because the excessive carbs and excessive sugar are stored under our skin as fats, which will make us become
fat big.
Yeah.
Okay. Now, you diversified diet. What does a diversified diet contain? What does it contain?
So a diversified diet contains all the food groups that we need for our body.
Yeah.
Yes.
That's the carbohydrates, the proteins,
the vitamins,
and the vitamins.
And the minerals. Yeah.
Now here is your balanced.
You see balanced, we diversified because we have incorporated everything.
So let's break down because normally the people who have 3 meals a day, the people who have 2, and the people who have 1. There's Gona.
We are changing.
He's going to change that. So in the morning, when somebody is having when you're having breakfast, what would be the appropriate time for somebody to have breakfast, and what should it contain? And then go to now lunch, and then go to dinner. And when you're talking about dinner also, you said we have to reduce the carbohydrates, the carbs, right?
Yeah.
What quantity? Are we having less ugali, a lot of vegetable? You know?
Yeah.
Where?
Are we? Yes.
3 hours kisha. Maisha ni magumu.
I want like break it down because tunakuanga na breakfast, lunch, dinner by saa 5. Naona watu wengine with very pretty much half a bread. Saa 5.
Yes.
Hivi.
Ya
Bread
usiku
half
ama?
during the day.
Ni nini?
Alafu saa 9 half a bread hivi na chai. Saa 9 kuna inaitwaje karai, viazi karai, pila au chapati nini. That's saa 9.
Hey.
Bado hiyo bado anasema haijatosha. Anangoja dinner. Let us help us so that I may become what I eat in the right way.
Yeah. So usually we start with breakfast and make it a heavy meal because that is what keeps you going and starting throughout the day. But unlike Kenyans, unaamka tu kama umeamka and then you go where you want to go. And then you remember around 1 like, whoa, sijakula. You go to the next fast food joint or the nearest kibanda, you mix all the things you want and then you eat. Immediately ndio hiyo kusikia dizziness, hiyo kufeel satiety, unashinda ukion here and there. Okay. If you want to have a healthy weight, you should increase intake of whole grains. Sawa?
Ambia wengine whole grains ni nini?
Yes. Whole grains in terms of umeamua you want to eat ugali. Go for the whole meal ugali. Most of the people, the young people, they don't love the brown ugali.
Oh.
Yeah, but you can do the milled maize. Unaona ile kwa kisiagi? You go, yeah.
Hiyo ndio sima yangu.
Mashallah. I also take that. So you will go to the kisiagi, you order your unga. Ukipika hiyo sima, just a quarter of your sahani.
Yeah.
It will keep you full for longer.
Yeah.
Unaona?
Quarter.
So it has excess fiber. Like you cannot eat excessively as you're eating the white one. Trust me, ile ya duka hata ukikula the whole plate bado utasikia njaa.
Hiyo niligoma kutumia kwa sababu nilikuwa nakula mingi.
Yes.
Hii ya quarter ina depend pia na mwili ama ni kila mtu kwa sababu
it varies na nimekwambia earlier kila mtu akona the amount of kilocalories anafaa atumie depending on the ideal BMI of the person. But kama unajua where you are you take long time to eat, like you're doing the 3 meals, it's best to maximize on the complex carbohydrates, is whole grains sasa. Why? They have high fiber and they'll put you full for longer.
Okay.
Yes.
So Lily, what should contain? So I'm assuming now for the whole grain, we're talking about lunch, right? But now breakfast, because I'm big on breakfast, and it's true it can take me through a day.
Yeah.
When we say have a heavy meal during breakfast, for some people when you say that heavy meal during breakfast, ni ugali na strong tea. Tunasema venye vitu ziko kwa ground. Ugali wa jana
na pilau ya kulala
na pilau na nini. What should constitute that breakfast? So we have bread, and then the people who have bread and maybe tea, the people who have nduma and the sweet potato, the people who will have the mahamri chapati, some will go for sausages, some will go for mbaazi and chapati,
others for githeri.
What should contain? Am I looking at carbohydrates? Am I looking at a protein? Am I looking at the vitamins as well for this breakfast?
Yeah, for the breakfast also it should comprise of all the food groups.
Okay.
And mark my word, you can take the kilalo as breakfast. There's no problem.
Oh, good.
Yes.
Okay.
But now, if you're taking ugali and strong tea, where's the protein? So you can do ugali, strong tea, and mayai on the side. It is not a must for you to do tea in the morning. You can do juice, fresh fruit juice, still
not the boxed one.
Yeah.
Hallelujah.
Yes, you can do the fresh fruit juice. Take your egg. If not the egg, you can do the previous night kama ni nyama iko hapo, and then do the brown bread ama the brown bun. Yes.
Hapo pana sima na tena pana brown.
No, like if there's no sima, no, I'm saying
Okay, so even in breakfast, have a carbohydrate, have protein, have vitamins as well.
And also the tubers are good. The arrowroots, cassava.
Yes.
Yeah. They're very good. You see, those are the super foods that people don't know.
Si mnaona kila siku naziweka hapo kwa tin and you guys don't know.
Tutajua lakini sasa hayo maneno.
Now, what is the correlation between nutrition and diabetes?
Okay. Diabetes, for one, it's a condition where your blood has high sugar levels. And usually it happens when the pancreas cannot produce enough insulin. Now, the relation between nutrition and diabetes is very simple. Let me break it down.
Please.
When you're eating your food, it goes into the stomach, right? It has to be digested. So while it digested, it produces glucose, okay? So the body needs a form of energy to run the system like it always does. But now for someone who has diabetes, the pancreas cannot produce enough insulin to break down the glucose from the food into energy. You get. So that's the correlation between nutrition and diabetes. So that is why us as the nutritionist come in to safeguard the patient.
How would my nutrition habits lead to me getting diabetes?
Your nutrition habits. As I've said, one, your intermittent fasting, you're staying for longer hours without eating. It can also lead to diabetes. Obesity can also lead to diabetes. If you're living a life of obesity, automatically you're predisposing yourself. If you are depriving yourself enough sleep, also it will lead to binge eating, which will lead to obesity. If you are also in some physiological state as like pregnant women, some hormones during pregnancy can affect the insulin production. Yes.
So there's a huge connection between my diet and, because I like what you said, you are what you eat.
Yeah.
And we are in the habit of let's prevent it before we get there. Right? So you've broken down what a balanced diet should look like, what you've said diversified diet should look like.
Yeah.
For somebody who's diabetic, what should their diet look like?
Okay, for diabetic patients, I recommend a Mediterranean diet. So a Mediterranean diet means whole complex carbohydrates, lots of vegetables, and fruits.
Okay.
Yes.
But some fruits have a lot of sugar.
Yeah, fruits have sugar, but the quantity that you're taking matters, and the type also of fruit matters. We are used to 1 apple a day. Sends the doctor away.
Yes.
What was the slang?
Yeah, it was that one.
But you see, for the apples, we have a variety of apples. So the green apple is best. Why? Because it is high in fiber and less in sugar as compared to the Ambrose apple. The Ambrose apple is the red, yellow apple. Yeah. So for the other fruits, we have things like watermelon. It still has a lot of sugar. But now we limit the portion. We can take a quarter at a go. But if you take the whole or like the half of it, obviously the sugars will spike. Yes. But you cannot deny a diabetic patient fruits. Why? The portion size is what matters. Yes. You cannot deny a diabetic patient carbohydrates. But the patient can take complex carbohydrate. Yes.
Complex carbohydrate.
Yes, the complex carbohydrates are they include the milled maize, brown chapati, brown rice.
So niko na swali hapo kabla ufikie hapo kwa diabetes. Umesema hapo hiyo kukaa sana bila kula ule venye Gona anafanya, baadaye siku za baadaye utapata kisukari. Now sote hapa paka wewe tunafunga na kwa siku 30 na kwa siku 40. All of us hapa sasa hivi hapa ndani ya studio tutafanya hiyo ibada. So tuelezee hapa tutafanyaje, manaki na hizi funga ziko lazima tutafunga. Huu mwaka tuko na huu mwaka na ni siku 30. Tutakaa hivyo, jioni ndio tule. Na wajua watu wengine wanavyokula hapa. Wanachanganya mambo. Yes, please.
So most of the people, they make a certain mistake during fasting. Okay, fasting for 12 hours, there is no problem. Because we are doing it in a religious way, and we are bound to do it because it's our religion. You see. But now, when you are breaking your fasts, and that period of fast before we reach suhoor in the morning, what are you eating? What have you eaten? You cannot tell me you're breaking your fasts na ushakula ugali hapo, ushakula mahamri zote, ushakula nini. You have to start with the light diets. One, you're breaking your fast with a little amount of water.
Yes.
Number 2, you go to the dates and green tea. Okay? And then after a while, now you can now jump into the carbs.
Sasa green tea na maisha yetu haya, green tea si strungi.
So you can do strungi, but not for the hypertensive patient. Green tea is best. But if you are okay, you can do the strungi. You don't have a problem.
So now ukishapata tama la maji, and then umepata tende, halafu umekunywa hiyo green tea ama hii chai.
Yeah.
So how many unafaa uchukue muda gani sasa ndio ubugie, manake ni kula?
You see, after you have already broken your fast, around before Isha, you can start eating your main meal, because utakuwa umefungua hiyo 6:40 mkuna maji kidogo, you go and pray, you take the dates, and then you're only taking like 3 to 4 dates.
Ni 3 ama 5?
5 tena, sawa.
Haya jamani, kumbe pia ni 3 tu.
Suna ya mtume ni 3. Sasa vingine ni wewe unajiongezea. Yeah. So you take the 3 na hiyo green tea, ukao tulie, and then
akasabili.
Si lazima, but at least you'll have given yourself time. You see, my worry and concern is tunajaza meza all at once, alafu tuko tunakula. So by the time tumefika katikati, the stomach is already bloated, we are full, na hatujakula anything sensible. Tumekula tu wheat. So wheat, it will just do more harm than good to your body.
I have learned.
Yes. And then I was also advising my people, soups, protein soups are easily digestible, na zita kusaidia na hata kublotisha tumbo. So you can do broths like chicken broth, kama you're cooking chicken as the main meal, ama ni beef, unaweza kunywa hiyo na mahamri yako ukae utulie. And then ungoje the main meal. So ukikula hivyo kidogo kidogo, small frequent meals throughout the night, you'll have a good endurance time during the day. Alafu kuhydrate. People are not hydrating. Unajigongelea vitu mingi kwa tumbo, you don't have space kukunywa maji. What is very important, I say at least your period ya iftar unusiku, take at least 3 glasses of water, 3 to 4 glasses of water. Suhoor, before kushamaliza ile dako ya asubuhi, take another 3 glasses to 4 glasses of water.
Hapo kwa hapo?
No, so uamke mapema. Swali tahajjud, kunywa kikombe. Haya, kula chakula yako. Chapa ingine, then before fajr prayer kwa umechapa. Before suhoor, sai ni mapema kidogo unakunywa. Unakaa unatulia at least 3 kama utakuwa umeshindwa. So ukifanya hivyo, you will be well hydrated. Yani mwili yako itaendelea kama kawaida, and there are benefits to that fasting. Yes.
So it doesn't mean that now when you're fasting, when it goes to the evening, you accumulate food in your stomach that you would have eaten the whole day.
You should not.
Like breakfast and then lunch and then dinner. Accumulate all of it in a short period of time. It's not healthy.
It's not healthy. Because that you will not even eat a lot.
Yeah.
Yes. Because already tumbo itakuwa ishashtuka, like what is happening, what is not happening. Unaweka kila kitu ndani ya tumbo.
Maandamano.
Yes, maandamano ndio hiyo.
Tumbo ni tofauti leo. Sasa kuna sisi ambao tumekaa sana bila kula. Tunaweza juaje pengine mtu ako diabetic, anaweza jijua ama ni lazima aende hospitali? Nimeanza kunishtua.
So kuna signs and symptoms to watch out. Sawa. Kuna dizziness, you might be feeling dizzy. You might be feeling thirsty frequently. You might be having frequent urination. And maybe when you urinate in the toilet, you might end up seeing white crystals in your urine, which means there's a lot of sugar in the urine. You might be feeling fatigue. Kuchoka all the time. These are migraines, headaches here and there. Yes. But now, you see, we have types of diabetes. Nilikuwa nimesema hivyo earlier, we have various types of diabetes. Tuko na type 1. So depending on the type of diabetes, depending on the symptoms and signs you're portraying, I am able to tell you which type of diabetes you have.
Yeah.
Yes.
Okay. Now, because we also talk about sugar a lot, and we've said there are fruits that have a lot of sugar. There's now added sugar. What's the effect of added sugar?
For one, added sugar is just luxury. Let me say so. Because everything has sugar. You see, in diabetes, we have two measurements of blood sugar. We have the FBS, which is the fasting blood sugar, and we have the RBS, which is the random blood sugar. So in the morning, before taking anything, if I measure your blood sugar, I'm supposed to find the number of sugar roaming around your blood should be 3 to 5. So if you eat in excess and I only need a little amount of sugar, where is the rest going? And every food, almost every carbohydrate has sugar.
So meaning I don't need to add sugar to my tea?
No, it's just for your mental state. Because you just, if your mind is tuned to, I have to take something sweet.
To talk to her.
What if the sugar translates to honey? Like, can honey work? Because I see other people, and like, okay, fine, I'm not doing added sugar, but we eat majimoto, you add honey.
Yeah, you can use it as a sweetener, but not for my diabetic patients. Yes.
So the diabetic patients, sugar is a complete no.
Yeah.
Okay.
But now, you see, for starters, you might meet a patient who is still in denial and cannot do without sugar, but we have sweeteners prescribed. Yes. But now we're using it just as a short term, and then we do away with it completely, just for the mental state of the patient.
And then now, what food should the diabetic patient avoid?
One, refined foods. So those are the white unga in the supermarket.
Yes.
White rice, white spaghetti. Yes.
Processed.
Yeah, those processed foods.
So it's everything brown? Because I see brown bread.
Yeah, everything brown is the way to go, even for non-diabetic people. And if you really love your life, maze, itabidi.
All of us.
Itabidi. Yes, all of us. And then there is something we call glycemic index. Each food has a different glycemic index. Glycemic index is the rate at which food ina release sugar kwa mwili. So unakuta the rate at which matoke ina release sugar kwa mwili, si the rate at which viazi karai ina release. Ukikula viazi karai, sugar inalipuka tu once. But for the matoke inakuja tu pole pole.
Umesema viazi karai sugar inalipuka.
Yes.
Lakini matoke sugar inaji. Hapo kwa viazi karai, I think umenielewa.
Yes, nakuelewa, because most of the people, you just fanya hiyo nini experiment. Wewe kula viazi, alafu ujiangalie. Unaanza kuiona, unasikia usingizi, unasikia nimechoka, yani una feel. So that's what happen when the sugars ziko high.
Yeah.
But ukikula matoke, cheki mtu amekula matoke hapo, atakuwa full for longer na atakuwa tuko very active.
No, wasi walisema sijui mtu akiji nini, sijui nini sugar rush nini huku.
Sugar rush ndizo hizo.
There are people who say, so because we're looking at dieting now, there are people who will eat the boiled food.
Yeah.
They hardly fry, you know, the boiled food. And then kuna wale, you have to fry something. Oil, fry, nini. What's the difference? How nutritious? I mean, it's not yummy. Between the...
Utamu galore.
All of a sudden, dieting is becoming so painful. Yeah.
Unauliza na uchungu.
Yes, nauliza na uchungu, but because we're looking at healthy living, right?
Yeah.
Lily, this side where I wanna fry my food, but then there's also a side ingine where I eat the boiled ones. What's the difference? I feel like I have the answer, but just sema tu. Nataka kuisikia.
Okay. So, there's something we call fat-soluble vitamins. So if fat-soluble vitamins, what comes into your head, it means we need the fats to be able to absorb the fat-soluble vitamins. But now we don't need excess fats, you get? We only need plant-based fats. Sawa? So if I am eating salad and then I decide to put the olive oil on top as a salad topping, that is okay. But if I decide to eat the salad plain, I will not get the vitamin A, vitamin D, vitamin E and vitamin K.
Hazitoki.
Naona? So hizo zinataka mafuta ndizo zikuwe absorbed. Sasa wewe una deep fry samaki ya nini?
It shouldn't be deep fried.
For what?
How should we cook fish?
Just cook na minimal oil.
Yeah.
Yes,
Kwa
and the
frying
oil
pan.
should and the oil should be from plants. Kuna plant-based oils.
Sunflower.
Yes. Elianto. Yes. Olive.
I remember
Kuna
Elianto.
coconut oil. Yes. So sisi tunakimbilia the cheapest oils in the market because tunataka kusave, but in future that is why most of the people here are having hypertension, because the veins penye damu inapitia inaendelea inakuwa covered tu na layer of fats.
How do I get rid of this layer of fats? Because
Umeanza kuchokoza
because how do I get rid of this layer of fats? Does drinking hot water, drinking hot water and lemon and ginger, does that help?
No. So if you're going to eat, if you're going to drink lemon, ginger, and then you go and chicken in, and then you eat again, what are we doing?
+1 -1.
Yes, +1 -1.
So but the question
So getting
is,
rid
does
of
it
the
help?
fats, how do you get rid of this fats?
Physical activity. Physical activity, and then
Enjoy it.
you limit the refined carbohydrates. So just take a Mediterranean diet, just like the diabetic patient. Yes.
Mediterranean diet.
Nilisikia mahali inakuaga na kasamaki.
It's allowed. See, for the protein haiongezi sukari protein.
Okay. Physical exercise.
Nilikuwa najua hapo ndio ulikuwa unakuja. Hii yote ni hapo
tu.
Tulikuwa naongea hapa. Kuna watu wengine hawajui kukimbia ni nini. Kuna watu wengine they don't want to use a skipping rope. Physical exercise. Not everybody appreciates, or not everybody enjoys running. Right?
Yeah.
What activities can one do? When we say physical exercise, what are they?
So one physical exercise is not just going to the gym. It means doing intense activity for 30 minutes. You have to sweat it out. So umeamua physical activity yako ni kutembea, and then you're just walking lazily. You're not helping. You can do a 30 minutes walk, which is very intense, and you burn a lot of calories. Yes.
Okay.
You can go to the gym, kwa treadmill too, you're just running lazily. You've not burned anything. Mwenye ametembea ameburn mingi hata kukuliko.
Okay.
Yes.
So
intense,
I just need 30 minutes.
Yes, 30 minutes every day
Kwangu.
for intense.
Na umesema
Intense.
Intense.
Underline the word intense.
umesema
Njoo tufanye basi.
nikitembea hapa mpaka pengine lights, bora tu nimeenda polepole sijafanya kitu.
Ujafanya kitu because your body is at rest.
At rest.
You have
comfort
to-
zone. You
is-
have to.
You see the way so the people who jog wanakimbia, lakini now the people who wanatembea haraka you have to burn something.
Now Miriam, tusaidie hapa kidogo. Kuna hiyo kutembea hiyo loosely,
Yes.
hiyo haitakikani. Ya
Yes.
gona.
Yes.
Gona anaweza tembea hapa mpaka Malindi, lakini very risky.
Yeah.
Na sasa kuna hiyo kutembea faster.
Yes.
Halafu na kujog. So which one hapo?
Kama you are jogging for 30 minutes intensely, fine.
Kujog for 30 minutes.
Yes.
Mungu wangu.
Ama uskip rope for 30 minutes. Na ni kuskip
Yes.
si ile ya jokes. Alafu na bado pia you watch your diet, because hawezi kuwa unafanya hii action alafu bado unaendelea kufanya careless eating.
Yes.
Yes.
Kuna kule ambako wengine wanaambiwa pia ukipiga zoezi usiachilie pia mambo ya kula.
You have to
Na kuna
balance.
mmoja anamsikia sana. Hii hapa tu. Kuna mmoja anamsikia
But
sana.
again, it depends what is the goal. Which goal do you want to achieve? Kuna wenye wanataka muscles, kuna wenye wanataka just to keep fit, kuna wenye wanataka specific body parts zikuwe in a specific way.
So tupigie mfano na mimi. Unaona venye niko.
No, I do have a question. Salim, before nini? Okay, let's listen to somebody kwanza before nije niulize swali langu. Good morning.
Good morning, Swahili Pot. Just
Yes.
an input on the breakfast menu. I'm listening to the conversation. Okay, countries that were colonized by the British, wao ndio wanajua kwamba breakfast ni chai, mkate, mayai. But countries that were never colonized by the British, they'll eat a whole meal as breakfast. Take Nigeria for example. Mtu anapika kabisa, utafikiri huku kwetu tunasema hiyo ni lunch, lakini for them it's breakfast. So breakfast is anything, so long as it's a balanced diet, it has all the nutrients, starch, protein, etc. Thank you.
Oh, that's Rosaline. Thank you so much, Rosaline. She's breaking down the balanced diet, and it's true. I didn't know certain things. I didn't know that you could actually wake up in the morning and have your ugali and have your rice and have a bit of you can even have mboga
na kanyama kwa mbali
in the morning. Yeah, because for us there's that assumption that this is supposed to be lunch or dinner.
Kumbe ni breakfast.
Kumbe it's just for breakfast. You just have to have that balanced diet, and it doesn't have to go with tea. You can have juice in the morning,
fresh,
right?
Yeah.
Now, for somebody who works out, they do their exercise, and then you always have to there's this thing with the banana. It brings back some electrolytes. A lot of science there. I don't know what it brings back to the body, but you work out. After working out, you have to eat something to bring it back to your body. What is that?
So, as I told you, the key point is what is your goal? Umeenda kwa gym, unataka kuachieve nini? Sawa. So before workout, there are some shakes we recommend. After workout, there are also certain foods you can take, certain healthy snacks you can take, depending on the type of exercise we are doing.
So before workout, there's something to be had.
You cannot go on an empty stomach.
Oh,
it's not allowed.
It's not allowed?
Yeah.
Tell them.
So wewe utakuwa umekausha kutoka usiku hujakula alafu umeenda hapo kukimbia bure.
Yes.
No.
And then after workout also there's a meal to
yes,
have.
Yeah, because I'm saying if you are not able to maintain your blood sugars, iyo kupanda kushuka, even if you do the workouts, your sins will catch up with you kule mbele.
What happens to these people who they go to the gym or they work out, but then unapata either they're gaining weight, and the intention was to lose, but they're gaining.
So one
is it that they're burning, wakisha burn, they eat excess?
Yeah, it can be a reason. Number 2, they are doing the wrong workout. Number 3, they are not having a proper diet plan.
Sasa Lily,
yes,
Mediterranean diet. Tuambie nini? If you've listened to this whole conversation, at least understand what a Mediterranean diet is and incorporate it in your diet. What does it entail?
So whole grains, plenty vegetables and fruits.
Okay.
Yeah, tayari.
Yes. So if you ukijifunza hiyo, you will be safe.
Mimi nimejua hiyo Mediterranean kwa sababu ni Mediterranean pana kasamaki hapo.
Whole grains, plenty vegetable and fruits.
Na fruits ka tayari hapo.
Kina beans, kina
yes, it's allowed.
Pojos ina follow up.
Yes, plant proteins you can consume.
Okay.
Yes. Other proteins zenyewe, they don't have a risk for in fact, if you have diabetes, hiyo haina sugars nyingi.
Kanyama ni size
kanyama
gani?
You can eat kanyama.
Ka size gani?
Scientifically supposed to take at least 6 to 8 pieces, but sisi tunakula nusu mzima. Because it's only a small amount which the body needs. The rest it's waste. Inakuja kuwa stored kama fat.
Hapa kwa fruits
8 pieces ikiwa kubwa ama tule 2 pieces
zile tudogo
kama cubes.
Unaona, you see how the Nairobian people cut their meat that size. Hiyo 8. Lakini kama ni ya Mombasa, you cannot do 8 ile Mombasa ile big because
ni mapande.
Hapa kwa fruits.
Yes.
There's a guy who said he gained weight just by having yalikuwa nadhani healthy because at lunchtime ndio wale watu wa fruit salad. You know? So he said he gained a lot of weight just by having that.
Yes, it's possible. Why? Because fruit, as much as the natural body iko na sugar. So eating one fruit at a go is ideal.
Okay.
But you're combining a lot of variety of fruits inside thinking that I'm eating healthy, but unafanya makosa. Like you see, for the diabetes patient, they only take one particular fruit at a go, not taking fruit juices. Tumesema nimechukua beetroot, nimechukua carrot, nimechukua maembe, nimemix. Sugars it has spike design nyingine ujai
Thank you so much.
Subiri. Hii kitu kuna mahali hapa tuelewane, manake sasa naona kama tutatizana hapa. Hii fruit salad.
Yes.
Sio hii.
No, that's the one she's talking about. The one that you have.
Yes, hiyo imechanganywa.
Hiyo that's the one she's talking about.
Sio hiyo.
Ni hiyo.
Ndio tuachane nayo hii.
Lakini si tunaweza kula mara moja kwa mwezi.
Yeah, you can do it kama kuna cheat days kwa kila timetable ya diet. Kuna cheat days. Kuna wakati unasema mimi na miss ile pudding na kimbilia unachukua, but isikuwe lifestyle.
Kukula fruit salad is not
not unless you're taking a very small amount, like a piece kadogo kama like 5 pieces kidogo bas, which is impossible. So for that kama umemwa ni ndizi, kule ndizi yako fresh.
Kama niembe.
Yes. Ukautulie.
Oh, thank you so much. We have been speaking to LilySophie Marao. She is a clinician nutritionist at Ganjoni Hospital, Mombasa. We have learned today. Yes. One more thing, darling.
So I wanted to say something. And also to make sure my diabetic patients understand the need why I go very harsh to them if they don't manage their sugars. Kuna complications zenye tunaweza pata if we don't manage our sugars for the diabetic patients. One, tunaweza pata sexual dysfunction. So utakuta mwanaume haezi kuwa anerect vizuri venye anafaa, and for the women wanapata vaginal dryness, which is kawaida. The other one, we have hyperosmolar hyperglycemic state. Unakuta mgonjwa amekuwa na sugars for a long time, so inafika state anakuwa na severe dehydration na anaanza kuwa na confusion. The other one is diabetic ketoacidosis. So this will happen if the body now start producing ketones, and that also happens to any normal human being. If you stay hungry for longer, your body now will start breaking down the fats from your muscles to convert it to energy, which in turn forms ketones, which in turn make the blood acidic. So signs and symptoms for the ketones, you might start vomiting, you might be having labored breathing. Yes, vitu kama hizo, dizziness, vitu kama hizo. We also have other long-term impacts like the retinopathy, which might make you become blind. We also have gastroparesis. We also have issues with the kidney failure. Yes. So like if we don't monitor our sugars, tunachazina misbehave, mara ziko juu, mara ziko chini, mara ziko juu, mara ziko chini. They now end up affecting internal organs of the body. So wewe you'll start giving us a hard time wakati sasa imefika imelipukia huko mbele. The other final thing I would like also to act to enlighten my people, especially my youth. You might be living a healthy lifestyle and still get diabetes through genetics. So we have genetic mutation conditions which happens in around 5% of the diabetic patient. So unakuta wewe umelive a healthy lifestyle, but simply because maybe your parent had diabetes na akona hiyo gene mutation condition, you might end up getting the diabetes. That's why we call it monogenic diabetes. Yes. Okay. And also for the pregnant mothers, they might get the diabetes, but it usually resolves after pregnancy, but we have to follow up 6 weeks postnatal. So you as the pregnant mother, usidhani umekuwa scot free after umejifungua. You have to do a follow up. We also have a delayed type 1 diabetes, which usually affect people. Type 1 diabetes is for the kids, but unajikuta uko 30 na uko na type 1 diabetes. Kwa sababu you had type 1 diabetes symptoms kitambo, but hazikuwa that strong, and then nakuja kukuhit ukiwa 30. So
thank you so much.
We still have a lot to
and I know there's a lot to talk about because we know somebody who has diabetes, and I like the fact that we've talked about our diet, what it means, so we manage what we have. And for those people who are diabetic, it's also about managing it. Right?
Yeah.
Thank you so much. We've been speaking to Lily, And we're breaking down nutrition and diabetes. When we get back, we'll have Ulfat Hussein Masiba. She's an executive director, One. It is International Women's Week. International Women's Day is taking place on Saturday. What is the future of women? You know, have we really achieved the 2/3 gender rule as we intend to as a country? 10 minutes past 9. We'll be right back. Good morning.